We see a lot of the toy breeds, smaller breeds, Boston Terriers, French Bulldogs, Yorkshire Terriers, respiratory distress, collapsing trachea, aspiration pneumonia, things like that, where they have to be put on oxygen therapy, fluid therapy, yeah.
A lot of the shorter face breeds that have respiratory trouble, so certainly anytime there's oxygen needed, I think a lot of times that's why we're called. A lot of seizures, I think
Yes,
we see.
seizures.
A lot of seizure cases.
Especially in the summer.
Yeah, well, heat stroke we've gotten our share of.
Boy, we have a lot of common ones.
Yeah. Well, and then, I think we get a lot of these sort of critical cases where the dogs really need oxygen or other kind of intensive medical intervention. We also get a lot of cases of just big dogs where their rear is having trouble. They can't get up, and the people just need trouble moving and transporting the dog just because of the size and mobility issues. And seems like frequently they're somehow up a flight of stairs or a couple flights of stairs. And yeah.
That's our specialty.
That's our specialty.
Big dogs and steps.
Yep.
That's why you work out.
That's why
That
we
is
work
why
out.
we
We said
work
that
out.
today, right?
That's right.
A lot of our dogs, the larger dogs that have trouble getting up, the owners have made an appointment at their vet. Doesn't have to be right away, but they'll make an appointment for the following day or 2 days later. So we'll assist in that. We offer transport to bring cats and dogs in for grooming appointments, wellness checks at their veterinary office. What else?
Yes,
What
and
else? What
people
else?
don't drive, older people,
Right.
medical issues where they just need not any emergency, but just pick the dog.
Or if they have a
cat
really
up.
nice car that they don't want to get messed up.
Yeah,
We've had quite a few
yeah,
of those too.
Some of those.
Well, the furthest that we've traveled is up to Utica, New York, to the veterinary hospital in Cornell.
And how far is that?
That is just over 3 hours away. Mileage, I don't know. I should.
Oh yeah, well, a lot
but it
of
was
miles.
a 3-hour trip each way.
But
And
we
really that's-
routinely go down to the city. I've gone up to Latham, New York, and Capital District often enough.
Stanford,
Connecticut, New Jersey. We just came back from.
Long Island,
Been to Long Island. That's a little more unusual, but
Brooklyn.
Brooklyn.
Been to Brooklyn.
Yeah.
Doesn't sound far, but it takes a long time to get there.
We like the deli in Brooklyn.
That was a good deli, wasn't it?
That was the
the
best. I think you only kind of once did.
The
what-
only farm type animal that we've done is a potbelly pig, I think.
Yeah, you did potbelly pig a while back.
And it was
right?
178 pounds.
What was that transport for? What was going on with it?
It was constipated, actually. It couldn't poop.
Were
So
you
we
able-
had to bring it
Were
up.
you able to help with that?
Well, we didn't have any accidents in the van, so
Well, better than most of the dogs.
yeah. I think it waited until we got to the veterinary hospital. Thank goodness.
So if you don't normally transport farm animals, why not?
Our ambulance is not large enough to fit farm animals in. I mean, we've had some pretty big dogs that could probably be considered smaller, large animals.
Yeah.
But yes, we just
I
don't
mean,
have the
right.
capacity.
I mean, I think theoretically something like a goat, not too large of a
Right.
pig, could be done. But again, the farm animals are somewhat of a specialty, really. I mean, even the vets specialize with that. The vets that we usually go to are not farm vets.
Plus, we
it's
don't have the
different-
medical equipment. Some
Right,
stuff
a
is
different type
so-
of equipment, yeah.
So what if a farm animal needed help? What would you recommend to somebody who needed those emergency services?
There's large animal
Yeah.
hospitals in the area, and 3, I believe that we know, offer in-home services, house calls.
They do,
things
right.
like that.
Farm vets will normally do house calls. The other thing is there are transportation companies that will do trailer, horses, llamas, things like that. And actually, if people, usually the owners like that would be aware of that. If they weren't, we certainly are aware enough to give referrals on that, both for farm vets that will come out as well as transportation companies. I think it was a 230, somewhat over 230-pound English Mastiff. We were actually coming back pretty late at night from a call and got a call about this dog who was unfortunately seizuring. And they said it was about 2:30, and I said, it was a local call. I said, usually people overestimate the size of the dog, so let's go. And
Not
they
this
were
time.
not overestimating in the least.
We did have a dog, probably 3 years back now, that was hit by a train.
Yeah,
Not a car, not a bike, a train, and survived.
yeah. The
Yeah.
dog actually lost a leg, but was literally hit by a train, banged up.
Several
guess they-
fractures, cuts, bruises.
Yeah,
A train.
yeah,
Yeah.
Intense.
Yes.
yeah. That dog hit by a train. The very first call I ever went on with Michelle was a dog that had been gored by a deer and was very badly injured.
That was
Uh,
pretty intense.
that was kind of my introduction to everything. I was like,
Mhm.
wow, this isn't just petting puppies and kittens. But that
And they
was,
both survived and are
Yeah.
doing fantastic.
yeah.
I am not an official trainer. Joe actually has a lot more experience.
I
in that.
do.
I'm
I
the medical
do some
part,
training
he's the
again.
behavioral
Right.
part.
I don't consider myself a trainer, but I do handle animals for an animal talent agency, doing commercial work. I've worked with trainers, helping with behavior, and it's something I sort of enjoy. I don't consider myself a professional trainer, but I do also, part of what we do is I enjoy and have an interest in managing the dog if it's anxious, if it's aggressive, is just, it's not so much training like you're teaching the dog something,
Right.
but how do you interact with and manage the dog, and that has to do with their behavior and how you work with them.
Well, I mean, a lot of the times we'll walk into a house and people are very upset. Crying, just, hysterical and trying to be very hands-on as we're trying to do things. So one of us will just kind of talk to them a little bit, bring them aside, calm them down a little bit and explain what we're doing and why. And that does seem to help.
I think it helps a lot. I think just having someone, just the fact that you're listening, that they're in a situation where maybe they don't know what to do and are feeling very anxious. And if we come and just say, like, it's okay, we know what to do, we can help you, is a big deal. And I am struck over and over and over is that when you come and are able to do something to help and are just, I don't think we're over the top. We're nice to people. We try to be, and we do, genuinely care about the animals, and we have some empathy for what goes on. But I think in those moments, it means a lot to people, and I'm frequently struck with how appreciative people are of just kind of the minimal kindness and will help. I remember,
there are some cases where obviously people are upset and they come across pretty, I don't want to say mean.
Well,
But
people
they're
are
just-
under stress, and I
Right.
think if we, understand that and just say, well, we're going to help. I remember a while back, I went out to remove a dog that had actually died while the owner was out, and her children were coming home from school, and she really wanted the dog removed. So I went there and removed it, and then we arranged the cremation, and we always deliver the ashes back when we do that. So when I brought the ashes back, the woman was really, hugging me and thanking me. And I said, well, I'm glad I could help. And she said to me, you don't understand. It was this horrible, worst situation, and you're here to help. Just that someone shows up to help, I think frequently just really means a lot to people. And it's rewarding for us.
Definitely. When an owner calls me for in-home euthanasia services, the number one question that I always ask is quality of life. What do you think your pet's quality of life is? Do they seem to be enjoying every day being around you and the family? Are they able to get up and go outside to go to the bathroom without assistance or exhibiting severe pain, soiling on themselves, incontinence? How's the eating and drinking? If answers to those questions are, no, you know, and we're having more bad days than good, then we really start discussing setting up an appointment. You know, where we can come in almost like hospice. We do work with a couple veterinarians in the area that offer, obviously, in-home euthanasia, hospice, palliative care. So we work in conjunction with them. And if we go in and we see that the animal is in distress from either a long-term illness, just, I don't want to say normal, but, you know, senior pets get issues, organ failure, severe arthritis, where they're just not able to be comfortable any longer. And I always say to the owners also that euthanasia, as hard as it is to make that decision to end your pet's life, nobody wants to play God. But I always say it's the last best gift that we can give them, to let them go with the most amount of dignity, least amount of pain. And that really seems to help them through.
I think a lot of people
process.
have trouble, you know, there's, especially nowadays, so much information out there. You get a puppy or a kitten, and you've got information right from day one, you know, housebreaking, litter training, what do you feed, how do you train, what do you do with the vet. And I think that it's been a little bit neglected is what you're undertaking is also the end of life. And people, I think, don't get a lot of information or preparation for this. This is part of the deal, too. And that sometimes you have to help make a decision to end their life. And there's nothing more painful than that. But it's part of pet ownership.
Right.
It really is.
And I always say, too, I can't make that decision for you. We're here to help, guide you through that. That's
You
funny.
could.
Hell no. You can hand me your dog, but when I give it back, it's not going to look like a dog. Medically, I can help you with whatever. Behavioral is him. Grooming, we leave to the professionals.
Yeah, leave
you
it.
do not want me.
Again,
Yeah.
That's another thing we can give you referrals on.
The only time I'm putting clippers on a dog in my presence is to get access to a vein so I can put a catheter in.
Yep. Clean a hot
or
spot.
clean a hot
For
spot or a
medical
wound.
necessity, shave down.
That's
But
it.
that's when the hair
That's
is
all.
gone. That's
Nope. I will walk your dog. I will. 5 days a week. Monday through Friday. We offer dog walking services and pet sitting, and also in-home boarding with the walking dog